Hello, this is my case control study population attributable risk of oral cavity cancer in the eye care study. The purpose of the study is to estimate in France the PARs of oral cavity cancer to several recognized and suspected risk factors, overall and by subsite, gender, and age. The study emphasizes the role of combined tobacco and alcohol consumption in the oral cavity cancer burden in France and gives an indication of the proportion of cases attributable to other risk factors. The study analyzed data from 689 oral cavity cancer cases and 3,481 controls included in a population-based case control study, the eye care study. Unconditional logistic regression models were used to estimate odds ratios, PARs, and 95% confidence intervals. The PARs were 0.3% for alcohol alone. The population attributable risk was 12.7% for tobacco alone, 69.9% for their joint consumption of alcohol and tobacco. The PAR to combined alcohol and tobacco consumption was 74% in men and 45.4% in women. Among suspected risk factors, body mass index 2 years before the interview explained 35.3%. Never tea drinking resulted in 30.3%, and family history of head and neck cancer explained 5.8% of the cancer burden, respectively. 93% of oral cavity cancers were explained by all risk factors, 94.3% in men and only 74.1% in women. In conclusion, concurrent smoking and alcohol consumption have a correlation with oral cavity cancers and could potentially be avoidable through cessation programs. Additionally, if the majority of cases are explained by recognized or suspected risk factors in men, a substantial number of cancers in women are probably due to still unexplored factors that remain to be clarified by future studies.